Hi, my name is Jasmine. I work at Ignite as a counselor and life coach with my master's in social work. This week, we're going to talk about breast cancer and how it affects individuals and their families.
Hi, I'm Kendra Pleward. I'm the owner and operator of Cha Cha's Boutique, where you can find fashionable lingerie that fits. Want to give you a few statistics about breast cancer. 1 in 8 women are affected by breast cancer, and 1 in 1,000 men. In 2013, there was an estimated 39,620 women who died from breast cancer. Breast cancer ranks only second in deaths to lung cancer. In 2013, there was an estimated 2.8 million people with a history of breast cancer. And there's 85% of breast cancer diagnoses that occur in women without breast cancer history. So, Jasmine, why are you involved in this?
So, I became involved with breast cancer probably first as a hospice social worker and then as a medical social worker at Riverbend. I have had patients and families both struggling with the illness and receiving treatment, as well as friends and classmates. No immediate family members, thankfully, but I've known several women in my life that have thankfully survived this. Um, I think another reason I got involved in this project is because I felt very passionately about finding more ways to support women, and this seemed like a good project that would align with that and hopefully make somewhat of a difference in our local community. So, why is this important for you?
This is important for me because I have had both family and close friends diagnosed and luckily have survived the diagnosis. My mom actually was diagnosed and is a survivor. She was adopted as a baby and has no medical history, and so she is one of that 85% that it was had no medical history unknowing when she received her diagnosis. I've also had close friends as young as 35. So it is something that is not just personal to me because of uh, close friends and family, but also it is personal because it could happen to myself.
So, we're going to talk a little bit about some of the issues affected by those with breast cancer as well as their families before we talk about the special project that we will give you some details at the end of the video.
So, Jasmine, once you've received the diagnosis, what information is important for the person who's been diagnosed as well as their close friends and family?
Well, generally, the first piece of advice, and this is with many diagnoses, chronic illnesses particularly, is getting accurate information. And that's from your medical staff, doing research on your own, but working with your doctors and the team of professionals that give you the initial news. So some of it's finding out the varied treatment options, the stage your cancer is in, and also the prognosis. So in thinking about this, it's important to think about the particular individual that you're working with or that this is affecting because everyone deals with illnesses differently and diagnoses differently, and this can be really overwhelming. And it's hard to say from person to person who's going to need what kind of support they can accept, and what support their family will need as well. It can be really scary to get a diagnosis like this, both overwhelming and worrisome as far as how am I going to pay the bills, how am I going to feel, what's going to happen in my future. So, for that individual to have as much power and control as they can is really important because they're going to feel like that's kind of stripped from them initially. Um, while the medical team is going to feel like often will align with that person, and even family will feel like they're going through it with that person. It's really important to remember we're not in that person's shoes entirely. That they are the ones that suffer the consequences of the treatment that they choose, both the costs emotionally and financially. And so we need to make sure we honor that.
I really like that you indicated that it's important that they feel like they're making the decisions, and it's important to remember that because I think, at least from my experience, people that I know have gone through that diagnosis, sometimes it can feel like it's out of your control. So being able to bring that back into your control, I think, is important.
Yeah.
What kind of coping skills are important to remember when you've received this kind of diagnosis?
So, and like I said, well, every individual is different. Everybody will receive, um, can receive support differently, and different coping skills will work for different people as well. But both for the individual and the family, any of these things can be helpful, and that's trying to stay positive, envisioning a good outcome, receiving counseling. Support groups are often really important for those with illness or even families if they can find groups for families. Just having other people that are experiencing the same thing can help you feel less isolated. Um, Rallying in your own friends and your own family as much as you feel comfortable sharing that information, journaling. Another important one is activism and advocacy. This is another way of kind of reining in your own power and control, sharing the news, trying to get people aware of breast cancer can be kind of another way to be positive about something that's kind of negative in your life. um, Besides counseling, maintaining some sort of routine in your life. So having a sense of normalcy is really important because a lot of things are not going to be normal in the coming weeks, but um, trying to figure out which routines, which things that you've normally done you can implement as best as you can while you're going through this can help you feel like less of a patient and more of a person.
I like that. I know that from my experience, making sure that you continue to have conversations about other things, it can kind of feel overwhelming talking about just the one topic. So making sure that you're talking about everyday things can make you feel, remind you that you are human and that you have a life outside of that. So I think that's really good.
Well, it made me think actually one other thing was just, sometimes people don't want to overburden another when they have these terrible diagnoses. Like, what do I have to say? I mean, I shouldn't be complaining about my life, but I can imagine, and I haven't been through this, but that somebody else would still love to be the listening ear for a friend. So,
And what do you think it's important when wanting to offer help?
so that's another one that can be tricky because sometimes, well, usually initially, I think after the diagnosis, everyone wants to come rushing in and help with whatever they possibly can. And while that's I'm sure gratifying in many instances, it can also be overwhelming, particularly because at first you may not even know what you're going to need help with. You don't know what the bills are going to look like. You don't know what your schedules are going to look like exactly. And you don't know how long potentially your treatment will last. So, one thing, and this is another piece of just allowing the person with the diagnosis to have some control in scheduling what they need, what they want in their lives, and those needs and wants will change over time as well. Perhaps they'll be sicker during the fourth week or the sixth week or at month two than initially, or maybe vice versa. And even after time, particularly maybe some of the people that have offered help will run out of that ability. Maybe there'll be scheduling conflicts, and so it will be important for people to keep open communication. I don't ever think it hurts to ask. Finding a person to ask, even if you can't talk to that individual yourself, but just suggesting ideas. Sometimes the individual, may have a whole list of ideas of ways people could help, but hasn't thought of other ways or things they can do most things on their own and doesn't need help, but others can offer things that they haven't even considered. And maybe it's to help your family. Maybe it's not even help you, but help your kids, help your significant other, your mom and dad
Mhm.
process this. So I think the other piece is often it is really hard to accept and receive support. And so we just need to remember that. I think individuals can get offended when they're not, when their support is not asked for. But sometimes just knowing people are out there willing to do that is kind of the support you can provide at that time.
I think that from my experience, I also think it's important that you consider what your relationship is and what support your help you're offering. So if you're someone close, offering to help clean someone's house is not something that's outside of the norm. But if you've met the person once, it might be a little
Yeah.
uncomfortable. But I also think that making sure that you're offering something specific, not just saying, tell me if you need help. Make sure you offer something specific. I can bring the kids home from school if you need me. Because I think it's easier to accept something
Specific.
that's specific versus just some vague offer of help. So I think it's important that you plan that instead of just making a vague offer.
That's
So
So the special project we want to talk to you about is called Ignite Chachas for Tatas. So we're making handmade copper bracelets. We've hand stamped them ourselves, and we've donated our time and the materials for these. And so they'll either say Ignite Inner Strength or Live Love Chachas. And if you buy just that itself, it will be $15. We've allowed people to do something more specific where you can add initials or a short phrase. I think it's up to 10 words for an additional fee, which you can find on our websites. But this just is one way that we found that we'll fundraise for breast cancer. So go to Etsy, and Ignite LLC has a way that you can find those bracelets, or chachasboutique.com. Either place, it doesn't matter. The proceeds will go to the same place, where we just are having two different options for people to choose them. If you're here local and you know us, just contact one of us, because then you won't have to pay the shipping costs.
and all proceeds will go to OHSU's Knight Cancer Institute, and those proceeds will help them meet their goal of their $1 billion fundraising effort by September of 2015. We appreciate your support, and we hope to sell out. So thank you.
So we'd love if you would share this video, because this will help us get the word out. Please like it, comment, ask us questions. We hope that this will be successful. Hopefully we can do another update, at least via blog, if not another video, to just let you know how much we raised in the end. But we'll keep doing this, particularly through the month of October, which is Breast Cancer Awareness Month. So until then, take care and stay healthy.